Chronic pain is a persistent and often debilitating condition that affects millions of adults worldwide. For many, conventional medical management, think medications, physical therapy, and lifestyle changes, doesn't provide enough relief. This ongoing struggle leads patients and clinicians to explore advanced options such as spinal cord stimulation or SCS. But what exactly is SCS and how does it compare to traditional treatment? In this video, we'll walk through the latest evidence from a comprehensive systematic review and network meta-analysis, shedding light on how SCS is changing the landscape for chronic pain management. Spinal cord stimulation, or SCS, is a therapy designed for people who haven't found relief from chronic pain with standard treatments. It involves implanting a device that delivers mild electrical pulses to the spinal cord, interrupting pain signals before they reach the brain. Over the years, SCS technology has evolved, introducing new modalities like high-frequency SCS, burst stimulation, differential target multiplex, DTM SCS, and closed-loop system. Each of these approaches aims to improve pain relief, physical function, and overall quality of life for patients. But how do these different types stack up against each other and against conventional medical management? Previous reviews of SCS often excluded direct comparisons between different SCS types, leaving a gap in our understanding. This new systematic review and network meta-analysis set out to fill that gap by combining both direct and indirect evidence from randomized trials. By doing so, researchers aim to provide a clearer picture of how each SCS modality performs, not just against conventional medical management, but also in relation to each other. This approach helps clinicians and patients make more informed choices when considering advanced pain management options. To ensure a thorough and unbiased review, researchers searched major medical databases like EMEDLNE, Central EMBAS, and Wikistim for randomized trials up to December 2024. They included studies that compared SCS to conventional medical management, other active interventions, or placebo in adults with chronic pain. The primary outcome was pain intensity, while secondary outcomes included physical function and health-related quality of life. By using a network meta-analysis framework, the team could integrate results from both head-to-head and indirect comparisons, offering a more comprehensive assessment than traditional meta-analyses. Review included 16 unique randomized trials, covering a range of SCS types and comparators. Across these studies, all forms of SCS showed significant reductions in pain intensity compared to conventional medical management. The mean difference in pain scores ranged from about -2.4 to -5.6 on a 0-10 scale, indicating a clinically meaningful improvement for many patients. Some novel SCS modalities like DTM and burst SCS even outperformed conventional SCS in certain comparisons. However, the certainty of this evidence was rated as low, mainly due to risk of bias and variability among studies. Beyond just average pain scores, the analysis looked at responder rates, meaning the proportion of patients who achieved at least a 50% reduction in pain. Here, SCS therapies again outperformed conventional medical management, with odds ratios ranging from about 10 to over 60, though the certainty of this evidence was very low. When it came to physical function, several SCS types including burst, DTM, and closed-loop systems showed statistically significant improvements compared to conventional care. Still, the magnitude of these improvements varied and the evidence was rated as low certainty. Health-related quality of life, or HR-QOL, is a crucial outcome for people living with chronic pain. The review found that all SCS types led to significant improvements in HR-QOL compared to conventional medical management, with mean differences ranging from 0.15 to 0.29 on standard utility scales. Notably, closed-loop and DTM SCS showed advantages over conventional SCS in this area. The certainty of evidence for HR-QOL was moderate, suggesting that SCS probably improves quality of life for many patients with chronic pain. While the results are promising, it's important to recognize the limitations. Most included studies had a high risk of bias, often due to lack of blinding and variability in control group performance. Differences in how control groups like conventional medical management or SCS performed across studies could influence the observed treatment effects. This means that while SCS therapies are generally effective, the exact magnitude of benefit may vary depending on study design and patient population. The authors stress the need for better reporting and more rigorous trials to strengthen future evidence. Patients with chronic pain who haven't found relief through standard treatments, SCS offers a valuable alternative. The evidence suggests that all types of SCS are likely to provide meaningful improvements in pain, physical function, and quality of life compared to conventional medical management. While some novel SCS modalities may offer additional benefits, the differences between them are often subtle and may depend on individual patient factors. Ultimately, the choice of therapy should be guided by a thorough discussion between patients and their healthcare providers, considering the latest evidence and personal preferences. As the field of spinal cord stimulation continues to evolve, ongoing research is essential. Future studies should focus on improving study design, reporting, and transparency, especially regarding control group performance and adherence to therapy. There's also a need to explore outcomes like the proportion of patients achieving very high levels of pain relief, and to better understand which patients benefit most from each SCS modality. With these advances, clinicians and patients can look forward to more personalized and effective chronic pain management options.